Now coming to the classification of thoracoabdominal aneurysm. The first classification is Crawford classification. It is called type 1 aneurysm, which involves most of the descending thoracic aorta and the upper abdominal aorta. Here you have the descending thoracic aorta and the upper abdominal aorta. This is type 1 aneurysm. Now coming to type 2, it involves most of the descending thoracic aorta and all the abdominal aorta, upper as well as lower abdominal aorta is involved. This is type 2. Now coming to type 3, it involves only the lower portion of the descending thoracic aorta and most of the abdominal aorta. This is type 3. Coming to type 4, it involves only the abdominal aorta including the visceral segment. This is type 4. So Crawford classification has 4 types depending upon the location. This Crawford classification was first proposed by Crawford in 1986. The classification is based on anatomical location of the aneurysm, the extent of the aneurysm and the clinical outcome. It is appropriately applied to aneurysm of all causes, be it degenerative or dissection. Type 2 and type 3 are the most difficult to repair because here the thorax as well as the abdomen is involved. Type 2 aneurysm have a high risk of paraplegia and renal failure because here the spinal cord ischemia and renal ischemia is common during cross clamping. Now coming to another classification which is called the DeBakey classification. This is used for dissection. Here there are 3 types. Type 1, there is an intimal tear in the ascending aorta and the dissection extends through the entire aorta. A dissection happens on the ascending aorta and the dissection is throughout the aorta till the abdominal part. In type 2, there is a dissection in the ascending aorta and the dissection is limited only to the ascending aorta. That is type 2. Now coming to type 3. Here you have A and B, type 3A and type 3B. In type 3A, you have the intimal tear in the proximal descending thoracic aorta with the dissection limited only to the thoracic aorta. In type 2, it is ascending aorta. In type 3, it is a descending thoracic aorta and it is limited to the descending thoracic aorta in 3A. Coming to 3B, this dissection extends even into the abdominal aorta or go up to the aortoiliac bifurcation. That is DeBakey classification. And DeBakey is used for aortic dissection with or without aneurysm formation. It is classified according to the extent of aortic involvement. And type 2 begins in the ascending aorta and extends throughout the entire aorta. And type 1 are repaired via 2-stage approach. In the first procedure, you repair the ascending aorta and the arch, and in the second part, you repair the descending thoracic aorta. Type 2 aneurysm are confined only to the ascending aorta. As shown in the previous figure, it is confined to the ascending aorta. And what happens with type 1 and type 2 is only the ascending aorta is involved and there can be aortic wall involvement which can lead to aortic regurgitation. So in type 1 and type 2 DeBakey, you should always look at the aortic wall and see whether any aortic regurgitation is there. Another important thing is the coronary osteo might be involved and there can be coronary ischemia. Type 3 just begins distal to the left subclavian artery and extend only to the thoracic part or go into the aortoiliac bifurcation. It is called 3A and 3B. Another classification for aortic dissection is called the Stanford classification. It is only 2 types, only proximal and distal. Okay. Stanford A involves the ascending aorta. Stanford B does not involve the ascending aorta. So to compare Stanford and DeBakey classification for aortic dissection, DeBakey type 1 Here you have the dissection coming from the ascending aorta and involves the entire aorta, and 60% is DeBakey type 1. Coming to type 2, it is restricted only to the ascending aorta. You can see in 10 to 15% of the patient. And DeBakey type 3, A and B, A is confined only to the descending thoracic aorta, and type B extends into the abdominal aorta. It is seen in 25 to 30% of the patient. And what is Stanford A? Here it is proximal, Stanford B is distal. Here the type A involves only the ascending aorta. Here you can see the ascending aorta is only involved with or without involvement of the descending aorta. But in Stanford type B, it is only the descending aorta which is involved. That is Stanford A and B.